Excellent evening, everyone. Welcome. We're all highly welcome to this evening's broadcast. How are we? Happy New Week to every one of us. I hope we have been great. Sorry, I'm running really late today. I'll tell you why later. Oh my goodness. With God, all things are possible. So always have that strong faith that you will make it against all odds, okay? That's my testimony for today. All right, so today, like we all know, we're going to be looking at menopausal infertility, okay? Menopausal infertility. And why I was running late is to make sure that our free book for today is ready for anyone who wants it. That's why I came in late. I wanted to be sure that it's available for everyone, okay? So we have a free book today for those who will join us live today. Only those who will join us live today on Aging with Grace as we look at menopausal infertility. It's an all important topic that everyone actually needs to, partake of. So it's so good to be live today. So if you've joined me online, you can greet good evening so that I can welcome you to this evening's broadcast. And also I ask that you share. Let's share this out to all the pages that we belong to, because like we know, it's very important that everyone, gets to know these things. They are absolutely very important. And of course, we know that a stitch in time saves near, especially for if you have young people, who are waiting for the Lord, for the fruit of the womb. It's very important that you go ahead and share this video out to them now, so that they can join us, okay? Welcome to every one of us. So I want to start sharing this out on my pages, and then we can get going this evening. And so I'm also asking, you can greet when you come in, so I will know those who are online with us and also greet them. And you can as well also share, because it's a very important topic, and every knowledge along this area will be good. And it's not just only for those who have reached menopause, but what we're sharing today is for everyone, okay? It's for everyone, because one way or the other, it's really very common these days to have people who are waiting on the Lord for the fruit of the womb, those who are having infertility problem. It could be men, it could be women. So it's important for us to just make sure we try to have some of these people and share this with them. So we are all highly welcome today. God bless us. It's a new week. I think this is the first Monday of June. Yeah, that's why we are treating different topic theme this month. That's why we are taking a new theme to talk about infertility, and throughout this month we're going to be looking at it from different directions, okay? So I want to greet those who have joined us online, and then we can get going today. Oh my goodness, this network should not start again today. I should have actually brought I just believe we will have good network today. All right, so you're welcome, Deborah Ojo, all the way from US. Like I said, when you come in, it will be good for you to just say where you're calling in from. It will help us, okay? If you just say where you're calling in from when you come in. So welcome, Deborah. Welcome, Gloria, Papa, Lua, Jen Destiny, you're welcome. Grace, you're welcome. Naomi, you're welcome. Janet, good evening from Shagamu. Mayowalabi, good evening. Good evening also. Adewola Nonye, you're welcome. Komolafe, long time. You've not been online. Okay, we have been here. We didn't go anywhere. Hello, Lukemi, you're welcome. Kate, all the way from Ghana, you're welcome. Welcome. Welcome, Afamon, you're welcome. Austin Malik from Ilori, oh wow, welcome. KTS from Ghana. Good evening from Abuja. Good evening, Gloria from Lagos. Wow, okay, so I'll get greeting more people later. But today we have a full day, so we will go on. And then again, if you want the ebook, if you want the free book, just chat me on my WhatsApp number. I'm going to put my WhatsApp number +234 703 5151642. Okay, and since it's a free book, you can go ahead and share to people. Like if you have people who would need this, you can go ahead and share it with them. So if you can go ahead and share with people, and then you can also give them my number to chat me so they can get the book. Okay, so because it's a free book, so I'll give it to you on WhatsApp today, because that's where I can access it immediately we finish. So if you need the book, just chat me and say, I need the Menopausal Infertility myths and facts. Okay, all the myths and facts about menopausal infertility and some facts about it. So we have there 15 myths and facts and a very short health tip that can help people who are waiting on the Lord for the fruits of the womb. Okay, all right, so we have Didi from Belgium. You're welcome, Didi. Welcome to this evening's broadcast. Hello, Helen Jimo. You're welcome all the way from Ota. All right, we are the opposite direction. You know, Ota is on the other side of Lagos, and we are on this side of Lagos. Welcome, Elizabeth Grace. You're welcome. Good evening. How are you? All right, so get going. We will just move on this evening as we look at menopausal infertility. All right, so we all know that women after 50, actually the truth is that even women who are 50 and above can actually have safe pregnancy. Thank God for technology, thank God for medicine, thank God for what is going on now. That, you know, it's not like before that they will say, women at this age will not be able to give birth. But thank God, okay, because a woman's peak reproductive year is between maybe like late teens, okay, when she's in her 20s, and then also that's the most they call it the reproductive stage of women, okay, when women are in their 20s. And then by the age of 30, fertility, that's the ability to get pregnant, will begin to decline. It's just beginning. All right, there's this paper I was reading, and it talked about how many eggs a woman can produce and how it starts decreasing, okay, as one is getting older. So this decline actually becomes more rapid when one reaches like 35, 37, and by 45 they say infertility has declined so much that getting pregnant naturally is really unlikely. Okay, that's naturally for most women. Of course, those of us who know that God of miracle, the God of Hannah, is still alive and he's still doing wonders. So we're not talking about spiritually, biblically, what God can do. You know, people usually say what God cannot do does not exist. So God can do everything. So now we are talking about naturally, okay, medically, and then normally. Let me put it that way. So, but usually, actually, as the years pass, as we are going on and on, technology is improving, and the barrier to pregnancy gets pushed further and further back. Okay, that's why in the news today you will see somebody saying, I'm 64 years, and you will just see them carrying their babies for the first time, 4 babies. 68, I've seen that. 54, 50, those ones are even becoming more common now. Okay, so it used to be thought that women shouldn't get pregnant after 40. Okay, but today, of course, we all know that some women even have their babies at 50s, at 60s. There's even one I saw on Facebook one time, and it was a woman of over 70 years, okay, carrying her baby. Wow, glory be to God. Hello Vero, you're welcome. Welcome Patricia, Madi. Okay, glory be to God. So like I say, and I always say, that anybody who wants, that nothing is impossible for God, and medicine is also, God is also helping human beings and medicine to actually go further there. So they did a study, the medicine is, scientists are also doing a lot of studies concerning infertility and women who are having infertility. So the study of women at about age 50 to 63, they took women that were about age 50 to 63, and these women were already postmenopausal. That's, they've not seen their period for 12 consecutive months. This is really very, very encouraging and motivating for us women. All right. So, and it revealed that increased number of complications, but nothing that cannot be handled, was actually found when they were monitoring these women. But you know what happened? You know that after menopause, a woman no longer produces eggs, okay, and thus cannot become pregnant naturally. And that's why I always advise women, if you're still at your prime age and you still have viable eggs, and you're having one kind of complication or the other, that's the time to really go for medical help. As you're praying very spiritually for God to help you, thank God that God is also helping medicine. Go and store your eggs. Find a good IVF hospital, those that are very good and very, they have integrity, and go and store the eggs while you keep trying, okay? So, but although egg succumbs to this biological clock of reducing when one is aging, pregnancy is still possible. Even if you don't produce eggs again, pregnancy is still possible using donor eggs, okay? So, all women in that study, the women between 50 and 63, for this study that was done, they had an egg from younger women implanted into their uterus, okay? That's women who had reached their menopause. They implanted these eggs into their uterus, and actually, there are really two biological clocks. One for the ovary, which seems to run out, and then one for the rest of the reproductive system, which goes on and on and on. So the ovary runs out. So when there is no egg, it's not as if the woman cannot carry pregnancy, only that she might not produce egg that can make her pregnant. So when she receives donor egg, she can have that donor egg when the conception is done externally, that's IVF, and then she now carries her baby to full womb. So all that is needed is actually a little priming with hormone, estrogen, and progesterone, followed by donated egg or fertilized egg, okay? That egg could have been fertilized. Some women, if their husbands are still very fertile, they can collect their sperm for the donor egg, and they now fertilize it before they now introduce it back into her womb, okay? So they did this study with 121 women, and 45 of them who were not producing eggs, who had these donor eggs, got pregnant, and the babies matured and they had their babies, which means every other reproductive cycle, every other thing was going on very well. Yes, there were a few complications for some of them. For example, about 78% of those women actually gave birth by CS, cesarean section. And then 20% out of those 145 women that carried those babies to prime due time and they gave birth, 20% of them developed diabetes, okay, which is called gestational diabetes. Now, compared to a more typical rate of like 5%. Then another thing that happened was the rate of high blood pressure. 35% of them had this pregnancy-induced high blood pressure, which before, for normal women, it would be just like about 3 to 5%. Now, it's not as if those conditions were not well handled, because they were under study. That's why I always advise any woman who is above 35 years, 40, 50, and you get pregnant, you need to start your antenatal care very early, and you need to really be monitored very well. So the side effects actually were tolerable enough, looking at the fact that 50-year-old woman whom the world would have thought is impossible for them to give birth was able to give birth. And again, another thing I advise is, okay, if somebody is getting to that age, you need to be very, very sure of your health state, so that you don't have all these complications by the time you get pregnant. And that's why supplementation comes in, because supplements will prevent all these diseases. When you're taking supplements, they will prevent all these diseases that are being that I've talked about, gestational diabetes. It will also prevent pregnancy-induced high blood pressure and things like that. Okay, so there are no real medical reasons why, this is from the study, no real medical reason why menopausal women who wish to have a child will not be able to have one. So if someone wants to be a mother at age 50, okay, it's a different thing. Okay, if you now want to say, oh, I want to be the one to bring the egg, I want to be my husband has to be the one to fertilize the egg, and then I have to be the one unfailingly to carry that baby to the end, especially if you know that there are some complications that will not let you. We have to face reality. And that's why it's good, the couple, if you're having infertility issue, you people need to go for counseling, and you and your husband prayerfully going for counseling to make sure that you're in line. I've seen a number of women who waited until they became so old that some of the earlier chances or earlier ways they could have had babies, they are not able to use it again. So okay, it's very, very important. We're going to be looking at some of possible causes of infertility in women, especially women that are menopausal. We're going to be looking at that very soon. But let me just welcome Helen Jimo, you're welcome. Welcome Patricia, welcome Eji Banam, welcome. Oh, from Canada, Bridget from Canada, you're welcome. Aika, you're welcome. Taiwo Lovett, you're welcome. Olubusayo, you're welcome. Mas Osebo, you're welcome. All right, so what are some of these possible causes that we were talking about? Number one is problem in your menstrual cycle. So problem with the menstrual cycle, which is the process that prepares the female body, the woman's body, for pregnancy, can lead to infertility. Like the menstrual cycle, some of these problems, the menstrual cycle phases and problems at any one of these stages can actually lead to difficulty in the person getting pregnant. Like, so if it's like heavy flow, no flow, irregular periods, all these those are some of the problems that will come with menstrual period, but that's one of it. Hello Chichi, you're welcome from Australia. Miriam, good evening. All right, so the second reason or possible cause could be structural problem in the reproductive system. Okay, structural problem usually involve the presence of abnormal tissues in the fallopian tubes or the uterus. So if the fallopian tubes are blocked, eggs are not able to move from the ovaries to the uterus, and sperm is not able, to reach the egg for fertilization. And structural problems with the uterus, such as those that may interfere with implantation, can also affect also cause infertility. Okay, then some specific structural problems that can cause infertility are endometriosis, uterine fibroids, polyps. Okay, scarring if you have a scare in your uterus from previous injuries, infection, surgery, an unusual shape of the uterus, which can also affect the implantation and the ability to carry the pregnancy up onto term. So that's all the reproductive issues. Number one, like I said, is menstrual disorder. The second one is reproductive system. Hello Kate Oji, you're welcome from Port Harcourt. Christy from Belgium, you're welcome. All right, so infection is the third thing that could actually cause female infertility. And infection can also be in men, not just only women. And when they are untreated, when one is having infection, when one is young, or when one is at that other stages, then if it's untreated, the person can, like gonorrhea in women can lead to pelvic inflammatory disease, okay? And then this might also cause scarring that will block the fallopian tubes. Then also untreated syphilis increases the risk of, pregnant woman to have a stillbirth. That's another thing that could cause women not having babies. So one needs to be very, very careful with infection, like chronic infections in the cervix and surgical treatment of the cervical lesion associated with human papilloma virus infection can also reduce the ability and the amount and quality of cervical mucus, okay? So also problem with the sticky or slippery substance that collects on the cervix and the vagina can also make it difficult for women to get pregnant. So there are so many complications, and that's why when one has not had babies after like at most 1 year, even it's always better for people when they marry to just go ahead and have their babies. If you marry, it's the next thing not having children. It's not actually good for one to start waiting, saying no, I'm waiting and waiting and waiting, and then you're not sure of what is happening, okay? So all these things are some of the things that could cause women not to have babies, and also men. Also, failure of an egg to mature properly. That's number 4 reason. When the egg does not mature properly, eggs may not mature properly due to variety of reasons, ranging from conditions such as obesity, okay? If a woman is overweight, and from overweight the woman now goes on to become obese, it can make the eggs not to mature. And that's why your weight is very, very important if you're looking and wanting to have babies. And this is what also causes this overweight thing, and obesity is another thing that will cause secondary infertility. That you find a woman who has had a child, and then she's now waiting for 8 years, 7, 9 years, 10 years, and she's not having her babies. Obesity can also be part of it, because many women, when they get pregnant, when they get married, we start adding weight, because some people say it's happiness. Well, you need to actually watch yourself very, very well. All right, so if you're obese and you're looking for the fruit of the womb, one of the things you must do is to do a complete body detox and weight loss program, so that you can reduce that weight. And our Clean 9 is one very, very good product that can help one to do that. It's one of the products that is fantastic, that will help one with weight loss, that will help reduce your weight and give you the right weight that can help your eggs to be okay. All right, another thing that could cause egg not maturing well is a specific protein that is needed for the eggs to mature. If one is not in good order with one's body, like an immature egg may also be released at the correct time. It may not make it down to the fallopian tubes and may not be able to be fertilized, okay? So when an egg is immature, it's not able to actually move down to the fallopian tube. Then another thing, the 5th reason why a woman might not get pregnant is implantation failure. Implantation failure refers to the failure of a fertilized egg to implant in the uterine, in your uterine wall to begin pregnancy. So while the specific cause of implantation failure are often unknown, some possibilities are genetic defects in the embryo, endometriosis, progesterone resistance, okay? So these are some of the things that could make your eggs not to be implanted in the uterine, okay? All right, then number 6, another cause that could bring forth that could make a woman not to get pregnant, another possible cause of female infertility is polycystic ovarian syndrome, okay? When a woman has polycystic ovarian syndrome, or what they call PCOS, is one of the most common causes of female infertility, and it's a condition which a woman's ovaries and in some cases her adrenal glands produce more androgen, that's a type of hormone, than normal. So when the androgen is produced more, it will cause PCOS, and then high levels of this hormone will interfere with the development of the ovarian follicles and then release the eggs which will debar the eggs from being released during ovulation, and as a result, fluid-filled sacs or cysts can then develop in the ovaries, and when these are developed in the ovaries, they are not good. They will cause infertility. And actually, research estimated 5% to 10% of women to have this PCOS, and the exact cause of this is really unknown, but current research suggests that a combination of genetic and environmental factors can actually lead to this disease. Hello Dickness Maureen, you're welcome from Ghana. Let's share this video out so that people can join us online today. And remember, like I said, I have a free book for us today. Everyone that attends this broadcast, you have a free book. If you just chat me on my WhatsApp number, I think I've pinned my WhatsApp number, let me be sure. If you just chat me on my WhatsApp number, you're going to get that book, okay? So once I'm through, I will just send you the book. It's an e-book, so you download it on your phone. So once I'm through, I'm going to share the book with us, and then you can have it. So I was saying that, you know, another reason, number 7, is primary ovarian insufficiency. Oh, they call it POI. Primary ovarian insufficiency is a condition in which a woman's ovary stops producing hormones, okay? And the eggs stops producing hormones and eggs at a very early age. Hello Josephine Okafor, you're welcome to this evening's broadcast. Welcome Chibuzo, welcome. All right, so women with POI, that's primary ovarian insufficiency, they normally ovulate irregularly, okay? And if at all they ovulate, they may have abnormal levels of ovarian and pituitary hormones due to problems with their ovaries. And women with primary ovarian insufficiency often have trouble getting pregnant, okay? So if such women at that early age is having that and they've not had babies, it now becomes very, very serious issues when they become menopausal, perimenopausal, or menopausal. So when women with this primary ovarian are having that problem, it's still possible, okay, to be pregnant, even though it's rare, but the woman can still get it. And remember what I tell us, it just depends on how you want to approach it. You have one life to live. Let me even say this here. You have one life to live, and all of us, we human, we all came in for different purpose. We all came in. If it's the Igbo, they will say onye obuna nwela kalaka di iche. We all have different purposes, different reasons why we came. God, our own Igbos will also say, I don't know how to say these things in English, you know, that chionye obuna di iche, chia kalaka, okay? So don't just begin to look at other women and look at other couples and think that how it is for them is how it will be for you. Everybody is working and living on a different lane. So if you're having a fertility issue, I beg of you, let me even speak this King James Version. I beg of you, reunite with your husband, and you people should forget what other people are passing through, how other people are having their own babies, and make sure that two of you agree. And if it's your desire that you should have babies, then go ahead and seek for counseling, seek for medical, seek for, you know, go around and make sure you seek for a way to have those your babies. And whatever you are advised on, from the right direction, from the proper people, make sure you do it. It's very, very important that you do this, okay? So because about 5% to 10% of women with actually primary ovarian insufficiency still get pregnant even without medical treatment, okay? They even get pregnant without medical treatment. Then the 8th reason why women may not have babies is uterine fibroids, okay? Uterine fibroids are non-cancerous growths that form inside the uterus, okay? And they can cause symptoms in such a way depending on the size and the location of that fibroid. Fibroids can actually contribute to infertility for about 5% to 10% in women, okay? And fibroid located in the uterine cavity as opposed to the grow within the uterine walls. So those that are larger than 56 centimeters in diameter are more likely to have a negative effect on fertility. Fibroids are also more likely to affect a woman's fertility if, one, they can change the position of the cervix, which can reduce the number of sperms that enter the uterus, or if they change the shape of the uterus, which can also interfere with the movement of sperm and implantation for the woman. Then blockage of ovarian tube, which also prevents sperm from reaching the egg and keeps a fertilized egg from moving to the uterus. Then also interfering with the blood flow to the uterus can also prevent the embryo from implanting. Hello, good evening, Olukemi. You're welcome. Rosie, welcome. Sylvia from Zambia, you're welcome. All right, so the ninth possible cause of female infertility is autoimmune disorder. So autoimmune disorder causes the body's immune system to attack normal body tissues, okay, and this could which it could have normally ignored. So some autoimmune disorder are like lupus, okay, Hashimoto's, and other types of thyroid issues, rheumatoid arthritis. People who have rheumatism and rheumatoid arthritis, they can have fertility being, affected. And then both men and women can also make antibodies that will attack the sperm or also attack the reproductive organs. Then also autoimmune disorders can cause the body immune system to attack normal body tissues that it would normally have ignored. And then autoimmune disease also could also be in men and also in women. Then the 10th reason, let me just continue and believe God. I have to run fast. I don't know why my network is having issue. All right, so number 10 is endometriosis. Okay, endometriosis. All right, so let's just stay tuned.